Good morning. This is another special edition of Political Paula that is not going to air on a Thursday. And of course, we are going to talk about the coronavirus once again. Over the weekend, I was actually encouraged. I was feeling a little less panicky because, again, I listened to the president and I listened to doctors, and I actually got to hear on the news from some actual victims of the coronavirus, and they seemed like they were doing fine. They said their symptoms were very mild. Mostly healthy people who get this virus tend to recover from it fairly quickly. You know, you feel like you got a bad cold, blah, blah, blah. So I felt good about that. And then this morning, it's Monday morning, I'm recording this. This will probably air this afternoon. Um, got a little bit more scary because, I'm in Pennsylvania. And now there is one case that was verified in New York, and we now have 2 deaths. Now, the people who died, not to panic anyone, the people who died were very sick to begin with. They were sick before they got the virus. But there are some things that concern me. And what really concerns me the most is what I heard this morning on 3 different news networks. All 3 news networks reported it, that at the CDC, where they're reading these tests, the coronavirus tests, there has been some contamination. There are some issues with the way they're reading the tests or doing the tests. I'm not sure exactly what's going on, but that is a problem. And I'm going to tell you a very personal story from my past. And many of you already know some of the issues I've been through with false positive tests that I've received in the past couple of years. Not couple of years, like in 2006. That was a bad year. So if we can't rely on the test, we might have an issue because there could be false negatives and there could be false positives. So people who have the virus are told they do not have the virus and go about your life, and they are now spreading the virus, or people who have the virus maybe don't have the virus. And that's why they're in isolation and they're feeling so great, and they have a little cold. Maybe they're testing for corona, and someone who just has the good old fashioned flu, which by the way kills a lot more people every year and doesn't affect the stock market than coronavirus has up till now worldwide. But I am concerned. So I'm going to start out by comparing the coronavirus to the AIDS virus when it first came to our shores. And there is a comparison. And it's interesting. The comparison, the way they are alike the most is in the government's reaction to them. Okay? So back when AIDS first came to America, the CDC started seeing a number of these pneumocystis pneumonia, this weird pneumonia that was affecting gay men in San Francisco, in California. And the CDC, the doctors were concerned. The World Health Organization was concerned. Our government, not so much, because of course it was Ronald Reagan time, and conservative and religious, and it's gay men, who cares? And even one I think I don't want to get the wrong name, but it was a very religious person that was in politics, said this is God's plague on the gays. It's only going to kill gay people. We're not going to worry about it. They didn't throw any money at it. The CDC was screaming for research money, for testing, and the government gave them nothing. Ronald Reagan did not even say the word AIDS in public until over 6,000 Americans had lost their lives to the disease. Now, let's remember what AIDS was. If you got AIDS in the 70s or the early 80s, you died. It was almost 100% lethal. There were no cures, and there was very little testing. They were actually using the hepatitis B test to test people for AIDS because they saw a commonality in that. All right? So the government wasn't going to put money toward fighting a gay plague, which is what they called it. Then the virus changed. Now, remember, when coronavirus, we are not sure when it started. So let's do the comparisons little by little. Okay. Coronavirus, actually, the World Health Organization got an alert in late December that there were a spiking number of cases of pneumonia in China, in Wuhan, China. Okay, the epicenter of this virus. And we didn't hear about it. I didn't hear about it. Did you hear about it? Anything in December about this spike in pneumonia and people were dying in Wuhan, China? No. And think what our own government was doing in the beginning of January, because in the beginning of January is when we first started hearing, well, this really isn't pneumonia, it's a new virus. And it's killed some people. It's actually killed a lot of people in China. What was our government doing in early January? The Congress. They were impeaching President Trump. They weren't talking about this virus outbreak in China. Now, our president, to his credit, he was listening. Because in January was when the president said, I am banning anybody traveling from China to the United States. That was smart. That was a good move. What screwed the pooch was that cruise ship. That's what screwed the pooch. And of course, the Democrats were probably screaming their heads off, oh, he's discriminating against Chinese people. He won't let Chinese people in our country. Because every time the president puts a travel ban out, they call him a racist. Well, this was a smart move. But then we had the cruise ship. And apparently, from what I have been hearing on the news, there was somebody kind of important on that cruise ship. The one that was coming from Japan, and everyone was quarantined. And he called his Republican buddies in Congress and said, hey, there's Americans on this ship. We're Americans. Get us off this ship. And whatever you think about President Trump, he wasn't happy about it, but he felt pressure. They're Americans. They should come home. Now, let's go back to the Ebola outbreak where Obama, now we've never had Ebola on our soil until Obama invited it in because Americans had it. Let's ship them in from where they have Ebola and bring them on into our country. Thank God that one didn't turn into an Ebola outbreak because Ebola, like AIDS, you die. People die from Ebola. You don't recover usually from Ebola. A lot deadlier than what coronavirus has been so far. All right? So I wasn't happy with Obama. I'm an equal opportunity when he brought the Ebola people here, and I'm certainly not happy that because this bigwig on this cruise ship forced our government to let these people come in when they were infected with this virus we knew in our country nothing about because Congress was worried more about spending billions of our taxpayer dollars impeaching President Trump, knowing they weren't going to get him impeached. They didn't care. They weren't mentioning it. They were impeaching the president. The president at least did the travel ban, which was a good thing. But then we let these people come in off the cruise ship. And I submit to you, I believe if we had not allowed those Americans off that cruise ship until they were 100% virus-free, we may not be where we are right now. I do believe that. And I think President Trump believes it too. He kind of alluded to it in his first speech from the briefing room the other day. That he really probably, if he thought about it, should not have allowed those people back in off the cruise ship. But political pressure. I'm a Republican. I voted for Trump. I voted for all of you. Get me off this ship. I'm an American. So that concerns me. But it's here now. We've got to deal with it. And how we deal with it is, again, we're going to compare it to the AIDS virus. Now, because of who AIDS was affecting, gay people, most Americans didn't care. Well, I'm not gay. I'm married. Or I use condoms when I have sex. It's sexually transmitted. And then it changed. Just like the coronavirus now, at first, you had to come from China or you had to come from the cruise ship. Now it's community spread, which means somebody got out. Somebody got a negative test when they were actually positive, and they went out. And now it's out there. It's here. With the AIDS virus, okay, when women and babies started getting it, and they realized it was in the blood supply, well, then the government took notice. But as Don Francis, the CDC doctor who fought so hard to try to stop it in its infancy, the AIDS virus, he kept saying, we could have stopped it. We could have stopped it. And then one of the victims of AIDS that was dying and eventually did die of the disease asked him, can you stop it now? And Don Francis said, I don't know. Now, we do know that the AIDS virus, the treatments have come a long way in the last decades. People have lived a long time. People with HIV have viral loads that are 0. They can't even be transmitted to other people. So we have made progress, but it took decades to get there. It took a long time because of the government's first reaction. Well, it's just gay people. And our government was so busy impeaching our president that they didn't even notice because it was Chinese people in this one little area called Wuhan that nobody ever heard of until now. They didn't care. Now, my personal story. While AIDS panicked me because, again, I was young, single, and having sex. Sometimes unprotected sex because I was on the birth control pill. And I decided to have an AIDS test. So this is what concerns me now when you talk testing for the coronavirus. So I had an AIDS test, and I had health insurance. I was working. And my AIDS test, believe it or not, I'm not very good. My body doesn't like this preventive testing shit, obviously, because I've had other issues with mammograms and pap smears coming back false positive. My AIDS test came back inconclusive. And I had never heard of such a thing. It's either positive or negative. I was, of course, expecting negative. But here's what my family doctor told me back then. This is going to go into my next concern about the coronavirus. My doctor told me, let's not put this blood test, through your insurance company. I said, why not? He said, because it's not negative. I said, well, so what? I said, inconclusive. I said, it's probably just a stupid mistake. The test wasn't done properly. He said, you really don't want this out there. You don't want your insurance company to know that you took an AIDS test and it came back inconclusive. Now, of course, I don't even understand why the insurance company would get the results of the test. But that's what my own doctor, my family doctor, advised me. Don't put it through insurance. Don't tell anybody. It's like, what? So now I'm really freaking out, right? I mean, I'm like, oh my God, are you kidding me? Are you trying to tell me I have AIDS? And he's like, no, but you really should have another test at some point. So I did, and it was negative. And of course, that was back in 1989 or 1990. And here I am, and I don't have AIDS, obviously. But that whole experience where don't tell anybody, let's not let your insurance company know. That's how it was back then for people with AIDS. You weren't allowed to tell people. Ryan White, a hemophiliac who had AIDS, he got it through blood transfusion. He wasn't allowed to go to school. Okay? Back in 2006, when I had a false positive pap smear and a false positive mammogram, I spent money out of pocket because when you get a false positive result, you have to pay to prove that it was a mistake. They're not just going to admit it, and they don't give you the next test for free. You get your one pap smear a year and your one mammogram a year. Under Obamacare, you get that for free. Insurance has to pay for it. But if you get a positive result, the rest, it's all out of your pocket. You pay for it, not to mention the stress of thinking, oh my God, I have cancer. Even though it turned out, of course, that I did not, because it's been a long time since 2006. And if I had cancer, if those tests were even remotely correct, I'd be dead because I have not gotten any treatment. And I do no longer trust preventive cancer screening. So now I'm starting to think, can we trust the coronavirus test? Are people getting false negatives, false positives? Because I've told you the other story many times of the woman I know who never missed a pap smear, never had an abnormal pap smear, and 1 year went in, she had stage 4 cervical cancer, and she died because the pap smears didn't pick up on her cancer, and that's why we go for the pap smear. So we really need to start thinking about if these tests are accurate. And my last concern, my really big concern, is this travel thing. The president came out on Saturday and said, do not travel. Americans, please. This virus is everywhere now. It's in the Caribbean, it's in Europe. Please don't travel unnecessarily. And let me just remind all of you my brother and sister Americans, your vacation is not essential travel. I don't care if you've saved 20 years to go to Italy. You're not going to go, I hope. Don't go. And here's the thing I want to tell you right now. Travel at your own risk, not mine. Okay? See, I don't travel. Oh, I used to travel when I was young, before 9/11 and all the TSA crap and now this real ID crap. Oh, I love to travel. I saw beautiful things. But you know what? I didn't come home and make anybody sick or kill anybody because I brought a virus home with me. So I'm going to tell you, as I sit and I watch the news and then the commercials come on, and, ooh, Perillo Tours, go to Italy, we've got great prices. I bet you do. I bet you can probably go to Italy for free right now. But what are you bringing home with you? And can you come home? That's my thing. The president has said Americans should avoid unnecessary travel to anywhere where this virus is. And this virus is everywhere but Antarctica. So, hey, you want to go to Antarctica for your family vacation? Bon voyage. But you go to any of these countries on purpose, that has this virus, well, then guess what? Maybe you don't get to come home. You don't get to make that call. I'm an American. Get me out of here. Now, I can't force anyone. The government, we're Americans. We can do whatever we want. We can travel wherever we want. Yes, you can. But what we can do is make sure that when you come home, you're not going to bring a deadly disease into this country, a new virus that we don't have a cure for, we don't have a test, a proper even vaccine for. You are not allowed to put millions of innocent American men, women, and children in danger. So go to Europe, go to the Caribbean, have a great time. But understand, there's a real chance you might not be able to come back until you prove you don't have this virus. And to prove that, we have to be able to rely on the test, which it appears now there is a chance that we can't rely on it. We can't rely on the test. And that is unfortunate. So, again, I'm not planning a trip anytime soon, and I am very happy to stay home. I'm one of these people that I'm a homebody. There are times when I don't leave my house except to pick up dog shit in the backyard for a month. I don't have a problem with that. And there's one last thing I want to make sure that you understand. And if you read the books like I have and you see the movies like I have, they might be fiction, but when you think about it, people are going to lie. Everybody on TV has seen. Any of you want to go to Nebraska on purpose and be quarantined in those little rooms where they poke and prod you all day long and you got nothing to do but stare at the walls and eat really bad food? Apparently the food sucks in the quarantine place in Nebraska. So how many people are going to be like, ooh, I don't feel well. I think I have coronavirus. Now I'm going to Nebraska on purpose. People are going to lie. Do you think any person that has been to Italy, we don't know when this virus actually came to Italy. We don't know what the incubation period is. People had AIDS for years and had no symptoms. They didn't know they had it. But they infected a lot of people when they were asymptomatic because they didn't know they had it. That's what was scary about AIDS. We don't know enough about this virus to know if you can have it in your system and never have symptoms. You just give it to people. You don't get it. There is a possibility of that. That's important to know. But once again, anyone want to volunteer to go to Nebraska and be quarantined for a month? I don't think so. So we have to also put in the human factor. Are people going to tell the truth? Have you been to Italy in the last 8 weeks? No. Let's get those pictures off the Facebook. Oh my God, there's a picture of us in Italy. Oh, take it off, take it off. And what would happen if the government decided to hack into everybody's Facebook page to see who's been to Italy, who's been to Greece, who's been anywhere where this virus is, and then insist that they get tested, and then insist that they get quarantined, and then we start having martial law, and it could get a little nuts. And I'll tell you why I roll my eyes at that, and I do roll my eyes at that, because from what I am actually hearing, and I am trying to stay calm about this as far as everyday healthy people are concerned. I've never had the flu. Never. I'm 55 years old. I have never in my lifetime had the flu. I have also never gotten the flu vaccine that they offer every year. I don't get it because it's only 45% effective. Why would I get it? I said yesterday on Facebook, if they get a coronavirus vaccine tomorrow, I'm not going to run out and get it. It'll be too new and I won't trust it. And again, I'm a very healthy person. No prescription drugs, no chronic illnesses. Even if I got coronavirus, I actually believe I would feel crappy for a week, maybe 2 weeks. I would stay home because whenever I'm sick, I stay home. I don't go out and spread disease. If I don't feel good, I cancel plans. I don't spread it around. I don't go out. I stay home. I read books. I rub myself with Vicks Vapor Rub and I feel better. So for someone like me who gets the common cold every 5 years and has never had the flu, I'm not really worried, even if I would happen to be exposed to coronavirus. I'm sure that I will be like those people on TV. You know, I didn't feel good for a couple days and now I feel great and it's fine. I'm good. But I'll tell you who of you should be worried. If you have a lung disease, if you have a chronic illness, if you have heart disease, if you had a transplant, if you are one of these people that even with the flu shot every year, you get the flu, you should be concerned. And you should be expecting your government to be spending more time worrying about this than they are about the November election, even than they are about the stock market, because the stock market is money, and money's important. But people's lives are more important than the stock market. So stop trying to calm everybody down so the stock market comes back. Be honest with the American people. Let us know what's going on. Let us know when it's time to really get concerned. And work, work, work. Stop blaming the president. Stop attacking the Democrats. Stop attacking the Republicans. Stop making this virus a donkey or an elephant, because it's neither. It's a monster that we don't know enough about to control. And we need to get this monster under control sooner rather than later. We need to work together bipartisanly in Congress to make sure there is money, money, money for research and good testing, tests that we can rely on and know are accurate. And we also need to restrict people who we know are infected from coming into this country. No more cruise ship evacuations because there's an American on board. Any American now who travels knowing that they are putting themselves at risk have no right to come home and put millions of others at risk because they just had to take that trip to Italy. No, you don't just have to take that trip anywhere. So I think we're going to see, I hope, people working together instead of blaming each other. Because remember, they say that Nero fiddled while Rome burned. Well, when this virus first got the World Health Organization's people who really knew what they were talking about, when this virus first got the attention of our government health people, our Congress was too busy to listen because they were impeaching the president, knowing that they weren't going to win that case anyway, knowing they didn't have the votes in the Senate. They were busy, too busy to do their job, which is working for the American people, protecting you, me, all American citizens, Republicans, Democrats, independents, gay, straight, pro-choice, pro-life, all of us from a deadly virus. Maybe if they hadn't been so busy hating President Trump, we wouldn't be where we are today. Can't wait to hear your comments. I promise you that there will be a show that does not have to do with coronavirus on Thursday. It'll be about the Harvey Weinstein verdict. We'll see you then. Political Paula, out.